What's going on, guys? I'm really excited because today we've got Dr. Tommy Lundberg on the episode, and we're going to be discussing transgender women in competitive sports. Now, this is obviously a very contentious topic, and there's a lot of miscommunication as well as misunderstandings on both sides. So, what I wanted to do was get Tommy on so that we could discuss some of the finer points about differences in physiology and determine whether or not transgender women actually do have a competitive advantage against women. Now, I want to be very clear, we are not going to discuss ethics or policies. We're just going to stick to the physiology and the differences between males and females and transgender women and biological women. So first off, Tommy, thank you so much for jumping on the episode. It's great to have you here. Can you quickly give yourself an introduction for those who maybe aren't familiar with you?
Yeah, sure. Thanks for having me. I'm based in Stockholm, Sweden. I work at the Karolinska Institute. I've done that for 7 years. So I defended my PhD 7 years ago at Mid-Sweden University in sports science. My thesis was focusing on muscle adaptations to training and specifically concurrent training, so the combination of endurance and strength training. So I guess the core focus of my research has always been centered around muscle physiology, adaptations to training, and things like that. And now, a couple of years ago, we also got the opportunity to sort of apply that type of research in a broader context, which is this topic that we're discussing today, the transgender individuals undergoing hormonal therapy, and we were interested in exploring the effects of cross-hormone therapy on muscular changes, etc. So that's how I got involved in this question in sports.
Yeah, it's definitely a really interesting topic. So to dive right in, can you explain what sexual dimorphism is and how that relates to athletic development?
Yeah, sure. So basically, males and females are different, and the physical differences start to appear more prominently during puberty. When males, a lot of it is because of the androgenization and the effects of testosterone that start to spike in during puberty for males. So all of a sudden, males reach much higher testosterone levels than females, and the result of this is that males are taller, bigger, they have more lean muscle mass, they have slightly different anatomical features over the hip, etc., compared with women. So this is the sexual dimorphism that you're referring to, that males and females develop differently. And this results in physical differences, as I mentioned, in muscular things like muscle mass, etc., but also in cardiovascular capacity, heart size, etc. And this have, of course, huge performance implications. And that's very easy to study because you can just compare world records or the average female versus the average male person, and you will find that the difference is at least 10% in world records in most sports, and it can go up to 50% in sports based. That is very much based on strength, power, especially for the upper body, etc. So it's important, I think, to understand that the very best, if you compare the very best woman with the very best man in a specific sport, they have trained very well, they have had a perfect dietary habits, sleep, recovery, the genetic potential is similar. So the only explanation for this 10 to 20, 30% difference is actually the sort of male versus the female development. So the sex difference is very, very big and very, very important for performance. And this is why we have separate sex categories in sport. And the female category is protected because of this male advantage.
Right. And in one of the papers I was reading, actually, they mentioned that testosterone can increase by 20 times in males going through puberty. Is that accurate?
Yeah, sure. So, I mean, typically females only have 1 to 2 nanomoles per liter of testosterone, and males have above 10, but up to 30, so between 10 and 30. So 10, 15 times higher values typically than females. So there's a big difference in testosterone levels. And this explains a lot of the differences in growth and muscularity, etc. But interestingly, it doesn't really explain the adaptive capacity to training, because when men and women build muscle mass quite comparably, even though men have higher testosterone. So it doesn't seem to be so much about the sort of training adaptation capacity. It's more related to the sort of general maturity and growth during puberty.
That's interesting. So you mentioned women typically have between 1 to 2 nanomoles per liter, and I know the International Olympic Committee, or the IOC, set the upper limit to 10 nanomoles per liter for transgender women. Now, I know some organizations have set it a little bit lower, I believe around 5, but I wanted to know where these standards are coming from, and do they actually reduce the physiological advantages of transgender women?
Yeah, sure. So the IOC have had very different versions of regulations for transgender participation, even already since 2003. So in the most recent guideline, which is from November 2015, as you indicate, they have the testosterone threshold set at 10 nanomoles per liter, and the testosterone level must be below that level for 12 months, so 1 year, before a person can compete in the female category. So we're talking now about transgender women. So that's a person that was born as a male, so biologically male, high testosterone levels. But if that person identify as a woman, that person can lower testosterone levels below 10 nanomoles through hormone therapy, and then compete in the women's category after 12 months. So that's the current regulation. The interesting thing is that I have not heard or seen a sort of rationale or an explanation for the regulation when it came out. So the IOC have never, to my knowledge, communicated the reason for 10 nanomole, the reason for 12 months, and the sort of physiological explanation for why they believe that this regulation would level the playing field, because that's the intention, right? So what the IOC say and do state very clearly in the guideline is that it is important insofar as possible to include transgender individuals in sports and in the category that they wish to compete in, but that cannot be done unless they can ensure fair competition. So they actually state that fairness in competition is the overriding objective. So that means that fairness comes first, according to the IOC policy. So this means that the therapy, the 12-month therapy, to be under 12 or 10 nanomoles, that must reduce the performance advantage. Otherwise, fairness is not achieved, and that's the problem right now. So the studies to date show that the hormone therapy, testosterone suppression, estrogen replacement, it reduces testosterone levels very effectively. So that's no problem. And with that sort of typical treatment, you go way below 10. In our study, for example, they're around one nanomole. So that's not the issue. So the issue is that the therapy is not very effective in reducing the male advantage. So typically we see changes in muscle, or decrements in muscle mass around 5%. Similarly, small changes in strength. Now, this is on untrained people, but it sort of shows that the physiological effects alone of the therapy, if you just disregard what would happen with training and stuff. If you just look at the hormone therapy, it seemed to reduce muscle mass around 5% in these transgender women. So which is only about 1/5 of the initial advantage, because males are 40-50% stronger and they have 30% more muscle mass. So it reduces a very small fraction of the advantage. And that creates this problem that you have sort of scientific arguments to propose that fairness is not guaranteed with this therapy. There is still a potential advantage of having been biologically male and then transitioning to a woman.
Yeah, so when I started diving into the available research, I was pretty surprised by how significant the advantages were. I know in weightlifting, I saw the male advantage was 30%, and in powerlifting, it was as high as 60% in some cases. And even in some of the research I saw, hormone therapy that extended beyond 8 years, the advantage here was only reduced by about 5%, kind of similar to what you had mentioned. Now, I also wanted to discuss the age that individuals transition. I've seen research showing performance differences before puberty still being about 9 to 16%, so quite a bit smaller, but most of the performance benefits appear to come after puberty. So I was wondering how much of a difference that makes in terms of the time that individuals transition.
Sure. So I think what you can say is, I mean, the performance difference between boys and girls before puberty is certainly smaller than the differences we see in after puberty. That's one thing. And I think they are also more inconsequential. So there are examples when a girl has had the sprinting world record for age 11, etc., for example. So more inconsequential. There are studies, and we cite that in our literature review on the topic as well, that show differences, average differences, even at very young ages in terms of throwing capacity, jumping, etc. So there could be differences. They are certainly smaller. I think sometimes it's not. I don't think we can be entirely sure that that the full potential difference is explained by biological factors. There could also be, social, cultural factors in the upbringing of boys and girls and these kind of things. So certainly the implications of the potential small male advantage even before puberty is not, by far not as, important as the consequences after puberty.
Right. And so what would some of those like sociocultural differences be?
That's certainly out of my expertise, but it can be, things like how girls are raised, how boys are raised, these kind of, stuff that is, hot in discussions as well in the society, gender roles and expectancies of what it means to be a boy, what it means to be a girl, what kind of activities you should do, if the opportunities are equal or not to play sport, train sport, do they have access to the same training, do they have the same sort of training opportunities, do they have equal coaching, etc. So, but again, slightly outside of my sort of research, but clearly those are factors that could be discussed as potential factors as well, contributing to differences. So some of the research I've read has shown a significant synergistic effect that wasn't really explained by differences in strength, power, or levers alone. So for instance, I know throwing was a big one, and even one paper that was looking at punching power actually showed a 162% difference in punching power between males and females. So I was wondering if you'd be able to touch on this and just kind of shed a little bit of insight on why this might be happening. Basically, if you look at the difference in muscle mass, if you look at the difference in strength, etc., you don't really reach 160%, right? So probably this is due to the combination of all the different factors. You mentioned some of them. So muscle mass, could be the anatomy of the upper body, it could be lever arms, it could be, tendon properties, connective tissue properties, it could be muscle architecture. So several factors where males have an advantage. If you combine them, the average the net effect of all these advantages results or culminates into a very big advantage in this case in terms of punching power, and that's my best explanation. And I haven't really tried to sort of break it down to some kind of mathematical model to make it to make the equation make sense. I do trust the study and the sort of data. I don't think there's a lot of studies though measuring these more complex sport-specific actions like a punching motion, for example. But clearly, when you add different factors together, the net results become, very big performance difference between men and women. I think it's the same in team sports, to be honest. I mean, because you cannot really attribute the big difference between men and women in for example, I was a footballer myself, so in Europe, so that means soccer in North America, right? So we know there, for example, that the Swedish women team are among the best, and they are beaten comfortably by the Stockholm County under 15 boys, for example. And we know that the American soccer team, the women's team, they are probably the best team in the world. They were beaten by Dallas under 15 comfortably as well. And these massive differences in performance cannot really be explained by the biological differences, because they have not really reached full maturity at this age. And we also have from sprinting, for example, that 14-year-old boys beat the best women sprinters, for example. So sometimes I think it's about adding several small advantages, and the sort of net effect of those creates ultimately an even bigger advantage.
So, one of the interesting things I drew from that paper was that physiological determinants for high performance can really change dramatically depending on the sport. So, for instance, power to weight ratios, upper versus lower body distribution and muscle mass, things like tendon stiffness, reaction time, and so on. So, I wanted to know, are there differences in muscle density and tendon stiffness between males and females? And also, how much is that actually affected by hormone therapy?
Sure. So, in terms of muscle density, it depends on how you measure it. Women have more, or females have more intramuscular fat in general than males. If you measure the protein concentration and stuff from a muscle biopsy, I think it's pretty similar. So I don't think there's a huge difference in contractile density, for example. I think that's pretty similar if you just compare it with the square centimeter or square millimeter area on the muscle. I think the contractile density is fairly similar. Women do have slightly more intramuscular fat. In terms of tendon and connective tissue properties, in our review, we do cite some studies indicating that males have an advantage there in terms of cross-sectional area of the tendon, and also the stiffness, which is important for force production. With hormone therapy, we don't really know what happened with tendon and connective tissue. Nobody has studied that, so we can't really say what happens there. There doesn't seem to be a substantial change, given that muscle strength per se is not changing that much. We do see in our study on transgender people, I think it's the only one who has looked at fat infiltration, and we do see a reduction in fat infiltration. They become actually more like the female reference levels than the male reference level after hormone therapy. So there does seem to be a reduction in fat infiltration. But again, that doesn't seem to translate to any big difference in or change in strength, for example. So, but yeah, very few studies have looked at that. So it's more most of the studies looking at longitudinal changes in transgender people have looked at lean body mass, hemoglobin, some has looked at strength, etc. But it's more these sort of more gross, crude measures of body composition, basically.
And I know one of the subjects that kind of comes up is bone mass and bone mineral density, and how that's potentially negatively impacted by some of these hormone therapies that are going on. And I've seen different research on that, and I remember when I was reading your paper as well, you guys definitely discussed that, and I was wondering if you could talk on that, and also just sort of relate it to performance. So how does bone mass, how does like skeletal morphology in general impact performance in a variety of different ways?
Yeah, I mean, a lot of that I don't think we know exactly, but our conclusion from reviewing the literature was actually that bone mineral density doesn't change significantly with the hormone therapy, and it makes sense because on a mechanistic level, estrogen is very important for bone mineral density and bone mineral or bone remodeling, and actually they get supplemented with estrogen, so it makes sense actually that bone mineral density doesn't change. So that means that they sort of maintain the bone densities, the sort of anatomical features of the skeleton, because obviously they don't reduce in height, so they are equally tall, etc., that they were prior to transitioning. So, and this it can be an advantage in many sports, like men have a narrower pelvis, probably better anatomy and biomechanics for some sports. I guess it's possible to find sports where it could be a disadvantage as well to be big, for example, of course. But in general, they maintain the structure that they have on the bones, and that could, of course, as well then translate into performance advantages.
Yeah, and I mean that makes sense because from one of the follow papers that I saw as well, there didn't really seem to be an increase in fracture rates when they were looking or following trans women over a 12-month period of testosterone suppression. So that does seem to kind of make sense then.
Yeah.
One thing that I was actually curious about was how like bone geometry would impact injury rates. So specifically for like, let's say lower knee injuries or something like that, or sorry, lower rates of knee injury.
Yeah, I remember I was trying to sort of read a bit on that when we did the review paper, because this is probably slightly out of my expertise as well, and I think it was difficult. I mean, there are some review papers suggesting that there are differences in injuries between men and women. It does seem to be not so much maybe about injury incidents per se, but more about where the injury occurs, if it's the knee or if it's the ankle or whatever. So that can differ. We certainly know in some team sports, like in soccer that I'm familiar with, that ACL injuries to the knee are much more common in female players compared with male players. I think it's like a 6 or 10-fold increased risks because of the different Q angle and pelvis width and stuff like that. So I think this differs between different sports probably, and there may be differences in where the injuries occur, etc., depending on if you have this sort of typical female anatomy or the typical male anatomy. I don't think the sort of injury implications are as sort of problematic or relevant in this sort of guideline discussion with transgender individuals in sports. I think this male advantage in strength and power and muscle mass has stronger implications for the need to protect the female category and the need for appropriate inclusion criteria.
Okay, so you don't necessarily think that it would confer a potential protective effect against injuries over females necessarily.
It could be in some sports and some at some injury sites, but then again, there may be other injury sites that are more common in males and stuff. So I'm not sure. But to be honest, I'm sure there are other people in the world that could answer that better, probably. But the thing is also that we don't really know, right? We're sort of speculating based on what we know from physiology and from the effects of hormone therapy and from reported injury sites and injury frequencies in sports. But we don't really know what happened with the injury risk in transgender people undergoing the therapy.
Right, that makes sense. And so one of the things that I was interested in as well is I remember that one of the studies that I was looking at was talking about there's sort of a bit of a disassociation between losses in muscle mass and reductions in strength. And it didn't necessarily seem that they had like a linear relationship. The one that I'm looking at in particular, let me just open it up. Oh, actually, this is your review paper. And essentially, one of the things that I found interesting was reductions in muscle mass, like I mentioned earlier, didn't necessarily seem to equate to an equivalent loss of muscular strength. And I just wanted to know why that might be.
Yeah, sure. So, muscle mass and strength are related at baseline always. So typically the correlation between muscle mass and strength is like 0.7, which means for people that are not into statistics and science, that means basically that muscle mass explain half of the variance in strength, basically. So it's not a perfect, it's not a one-to-one relationship, because there are other factors than muscle mass that affects strength. So obviously neural recruitment and neural firing frequencies, or the neural activation of the muscle is important. We have the tendon and connective tissue properties like tendon stiffness, tendon size and stuff. We have muscle architecture, pennation angle, how the sarcomeres are arranged, if they are in series or in parallel and stuff like that. So strength is more complex than just measuring muscle mass, but there is a correlation. What interestingly though, what we see and others see and has been discussed a lot lately in the research literature is that the change in strength and the change in muscle mass during a short intervention doesn't correlate very well. So you can have a very big increase in strength with almost no change in muscle mass, and you can have a big change in muscle mass with a quite modest change in strength. So the correlation is very low. So there's a baseline correlation, but if you correlate the change over an intervention, so the change in muscle mass with the change in strength, that correlation is much, much weaker, suggesting that other factors over an intervention are important for explaining the variance in strength. Could be tendon properties, neural activation probably as well, especially since many interventions are quite short. So that's probably one of the reasons why there is no perfect agreement between the change in muscle mass and change in strength. I think it could I think one potential factor a little bit as well could be that most of the longitudinal studies on transgender people so far has been on untrained people. It means that, and typically the studies can't really, logistically motivate, and the number of sessions the participants have to come in, etc. You can't really afford to do 3 familiarization sessions just to let them practice the strength test, for example. So there is a possibility, in my opinion, that there is a small learning effect from the baseline test to the post test. So let's say after 12 months. So basically then, okay, it's this test. I've done it before. I know how to do it. I'm going to do it even better now. There is this possibility when you study and measure very untrained people compared with athletes, for example, that you have a small learning effect as well. So I think that could be behind some of the studies where there is basically no change in strength at all. My sort of gut feeling is that I think both muscle mass and strength are affected fairly similarly by hormone therapy. So a small reduction.
Right. And so you actually mentioned something that was pretty interesting about most of the research being on untrained trans women. And I was curious how that might change depending on their level of training. So generally speaking, the common assumption is once you go on hormone therapy, your performance is going to decrease. It's going to see a marked decrease. However, that's not necessarily the case, and performance reductions aren't necessarily inevitable, especially depending on the level of training experience the individual has, what level of athlete they are, as well as even the efficacy of their program. And I think you mentioned specifically the program, the quality of the program in your review paper as well, because it's not only possible, but it's been demonstrated that several individuals, once they go through this, can continue making progress beyond their previous athletic ability. And so I was wondering why that might be, and some of the additional variables, I guess, that could influence an individual's ability to make progress, increase strength, increase speed, increase running performance, whatever it might be, pre and post hormone therapy. Sorry, I know that was like a really broad question, but
Yeah, sure. But it's a very interesting question because, and it has been discussed a lot. And I was involved in this sort of expert group that presented the scientific data for World Rugby before they sort of their policy group took the decision to not allow transgender female rugby players to play in women's rugby. And this was discussed there because obviously it's a problem from a sports perspective that we have no scientific information from studies on athletes, which is kind of obvious. There are very few, and they have not been, studied in research. So the information we have is from untrained people. So, and that has also been one of the major critiques towards World Rugby and towards, basically, so the people that argue that transgender women should be included, they claim that, the research has not been done in athletes, so the research is not relevant. What I argue is that the research is very relevant, but yes, we acknowledge that it has not been done in athletes. But what you must ask next then is, so how would that differ then? What would happen in athletes? So what some people seem to think is just that, okay, there are athletes, they are more trained, so they're going to lose more. Okay, that's theoretically possible, but very few, and this is very surprising to me, very few people acknowledge the fact that a transgender female athlete who's serious in her sport, she's going to probably want to continue to train, right? And maybe even do everything she can to minimize the negative effects of testosterone suppression. So that means undergo intense resistance training, high protein diet, creatine supplementation. There are a lot of things you can do to optimize the maintenance of muscle mass. Now, in that scenario, it's very likely that you don't lose anything, I think, because there are studies showing that you can build muscle mass on testosterone suppression. And there are studies on prostate cancer patients undergoing androgen deprivation therapy that they can increase lean mass, they can increase strength substantially on testosterone suppression. It's probably harder than, without testosterone suppression, but it shows that we still have a physiological capability to adapt to training. So it becomes a very difficult question to address because it's also like, and this is not so much a biology, it's more like philosophy, like do the trans woman, does she want to prioritize her athletic capacities at this point when she undergoes therapy, or does she want to allow and promote the sort of feminization of the body, which is really the intention of the therapy? But the problem is, for sports, they cannot sort of guess on that. They have to have regulations that ensure fair competition, and they can never, in my opinion, prohibit athletes from training. So they must be allowed to train. That's the core essence of sport. And obviously then there is a situation where, you know, they may lose some muscle mass strength. The athletes, they may even lose a lot if they are very trained from the beginning, and then they prioritize the hormone therapy and sort of allows the changes to occur. But they may lose almost nothing if they do everything they can to, you know, counteract the negative effects of testosterone suppression by resistance training, optimal diet, you know, optimize everything. So that's a very tricky question. In my opinion, it's a bit strange that this is not discussed more in this topic, because people just seem to assume that what happens in the sort of you're sitting on your couch scenario, that's sort of going to translate into the real situation. And then I haven't even mentioned the individual variability we have. So some in our study lost 10%, some lost nothing. What do you do about that? So are you going to just go with the group average values, or I mean, there's a lot of, it becomes very complicated from a sport body perspective when you sort of have to make guidelines.
Yeah, I definitely would not want to be the one in charge of that, because there's just so many variables to try and account for, and I think it's very difficult to ensure, you know, fair competition while simultaneously being inclusive. And,
right now it's not possible, and that's the issue. So that's the current situation, to be honest. It's not possible right now to balance those two, which means that sports has to prioritize one over the other. That's the current situation.
Yeah, I know in powerlifting anyways, or actually maybe I'm mistaken about this, but I believe that there are certain powerlifting federations that allow transgender women to compete within their own category, I believe.
Isn't that in Canada that someone actually tried to sort of play with the system and just said, hey, I'm a woman, I'm going to compete in the women?
Yeah, actually, I reread that article the other day. Gosh, I can't remember the name of the athlete, but yeah, something like that happened, and then it was determined after that the competitor was a transgender woman, and I believe they were stripped of the medal. But then I believe that now, I could be completely wrong here, so I don't know, but I believe that did lead to a creation of a new branch or a new class or category. I'm not sure exactly what you call it, specifically for transgender women. I could be wrong, but I know that there were at least discussions about that, and I'm not sure if that passed, but I'm pretty sure it did. But
yeah, that may be, and that's been discussed, but you know, it's problematic because there are so few still. So
yeah, you're kind of competing against yourself, I guess, right?
Yeah, exactly. The question, if you know, is it meaningful to have separate transgender categories? Yeah, that's a problem.
Yeah. So one of the other things that I guess I wanted to hear what some of the research said about was the impact on aerobic capacity and things like VO2 max and stuff like that post hormone therapy, and how that actually impacts aerobic performance.
Yeah, sure. So to my knowledge, there's no study that has looked at VO2 max per se, some actually measured VO2 max with hormone therapy. But quite a few studies have measured hemoglobin mass or hemoglobin concentration, I should say. And they typically show that 12 months is enough to reduce hemoglobin levels, essentially down to female levels. So hemoglobin seemed to be one of the parameters that have been measured so far that actually is reduced to basically, female levels. So that has implications for aerobic capacity, because hemoglobin is very important for oxygen carrying capacity, and presumably VO2 max goes down then. How much, we're not really sure. We've seen there's a case report from the World Athletics, where they measure performance changes in these are not transgender athletes, but DSD athletes like Caster Semenya, and they show that the performance went down in running events like 5%. Then there was a recent study on military people published in British Journal of Sports Medicine, showing that even though running performance was reduced in transgender women, it was not reduced, not even after 2.5 years was it reduced to the sort of female level. So there was still an advantage, but certainly I think the overall conclusion is that the males and females or transgender women, if you compare transgender women post-transition, post-hormone therapy with sort of reference women, there is sort of more, they are closer to parity and closer to fairness compared with strength, muscle mass, and these measures. Is the advantage neutralized completely? I don't think it is, at least not after 12 months. It could be after several years that that's the case. But this is just showing that each sport is different depending on which key physical determinants we play with in the different sports. So actually what we say in the later part of our review is actually that it doesn't make sense perhaps to have the same transgender guidelines for all sports, because they are different, and there may be a few sports where fairness could be achieved after a couple of years maybe, but then there are other sports where probably it can never be achieved. And then you have some sports like rugby, American football, contact collision sports, boxing, wrestling, whatever, that there are also safety concerns. So then you're not only balancing fairness and inclusion, you're also balancing with safety and player welfare, which is very important. And that was actually deemed to be at the highest priority for World Rugby, for example, when they took the decision to ban transgender players from, or transgender female players from the women's category in elite rugby.
More on the aerobic side, would some of those differences be, like, I know hemoglobin changed, like you mentioned, but then would some of those differences in terms of preservation be from kind of peripheral factors like capillary density, like total blood volume, the size of the heart, and like just kind of things like that, like the previous physiology of the individual prior to hormone therapy?
Yeah, I mean, I guess heart size is not going to change that much. I think blood volume is probably reduced because you have this, quite marked decrease in hemoglobin concentration, and that indicates to me that hemoglobin mass is probably reduced as well, and then probably plasma volume as well. So I think nobody has measured blood volume. We can do it in our lab, and we're sort of planning to do it on if possible on transgender cohorts in the future. But and blood volume is very important for VO2 max and for the stroke volume, more important than many people realize, because the heart cannot work alone to produce a high cardiac output. It needs to be filled constantly with the venous return. So greater blood volume means greater VO2 max generally. And if you take away the blood volume, or if you take away the increase in blood volume with training, for example, you also reduce VO2 max to the same extent, actually. So I think blood volume is important. But then you have, things like how does fat mass change and how does that relate to running and aerobic performance, and does that differ between cycling when you lift up your body weight compared with running, for example. You have the anatomical advantages potentially in running that you may not have to the same extent in cycling. So I mean, endurance performance is under research in that sense. We do have the study on the military persons, as I said, suggesting that there was still an advantage in running. It was 1.5 mile running performance. Cycling, we don't know, but I presume it's probably quite similar. It's determinant of, well, it's sort of power production, I guess, in the legs as well, which sort of speaks in favor for the advantage of the male puberty, and then you have the aerobic capacity, which is probably reduced. The question is, how much is it reduced and how long time does it take to be reduced so much that you can actually claim fairness to be achieved.
So, how do some of the molecular mechanisms in muscle memory play a role in the preservation of muscle during hormone therapy, and how might that actually impact the accretion of lean tissue in general moving forward?
Yeah, sure. So I think, the honest answer is that we don't know really, but we are currently doing analysis on biopsies that we've taken from transgender individuals, and we're going to look at myonuclear density and stuff like that. But if you look at the density of myonuclei, it's quite similar between men and women, actually. And there are, nice theories that myonuclei are long-lived and that you sort of have them for long, and that you potentially then would benefit. That's the whole muscle memory idea, that if you have acquired more myonuclei with training, you maintain the nuclei, and then if you have a long detraining period and then start training again, you sort of acquire muscle mass and strength faster because you have these myonuclei. This idea has been challenged very recently by some really good scientists, in my opinion, showing that they may be lost actually with detraining. So there's debate ongoing on that topic, and I think that the public or your sort of popular scientific view of muscle memory is a very attractive hypothesis. I think people believe it's more sort of cemented than it actually is, this theory. In my opinion, there are some studies supporting it, but there are probably even more studies not supporting it. So I'm not sure it has a big role in this, to be honest. I know that's really, we touched upon it in our paper, a few sentences. I know that other papers have discussed this even more, as maybe even as the primary reason for why this advantage would be retained, and stuff like that. I'm not convinced yet that it is the mechanism. It may contribute, but I don't think it's the key mechanism.
So, during testosterone suppression therapy, I know that estrogen is intentionally increased. Now, can you speak on the impact estrogen might have on anabolic signaling? And also, could that have a protective effect on muscle mass?
Yeah, that's one mechanism that I believe more in, that actually estrogen is anabolic, and we know that estrogen has a positive effect on muscle mass generally, like if you look at hormone estrogen replacement therapy after menopause, for example, in women, it has a protective effect on muscle mass, and there are also other experiments in animal models showing that estrogen is anabolic. So it could be that estrogen sort of rescues some of the negative effects of the testosterone suppression, sort of balancing it up a little bit. So that's a possibility, and that's potentially a contributing factor why muscle mass doesn't change more than just a few percent after 1 year. I think that's one potential mechanism.
I don't know. I guess this is a little bit of a newer branch of research that's kind of been emerging.
Yeah, and obviously in sports it has arisen, I think explosively in the
Yeah,
last
out of
couple of years
necessity.
because nobody. I remember when we started this project, which is like 6 years ago now. I didn't even think of it in terms of sports at that time actually, because all of these studies, including our studies so far, the primary goal has not been to study the implication for sports. It's been to study, clinical implications of transgender hormone therapy, potential risks, what happens with physiology, what happens with bone mineral density, do they have increased risk of fractures, do they reach their body composition goals. So the questions so far have been mainly clinical, actually, and not related to sports.
Could you just give like I guess, a brief overview of the current literature, just to kind of summarize everything that we talked about, and maybe, even some things that maybe I didn't ask, that's related to this subject in general?
Sure. So in terms of the research, there are 13 longitudinal studies so far on that have included transgender women and studied some aspects of physiology related to performance, mainly lean body mass, muscle strength, uh, hemoglobin, I would say, those parameters. Well, the 13 studies actually goes for studies that have included some measure of either muscle size, lean body mass, or strength. And they all very actually consistently show that these measures, muscle mass, strength, lean body mass, are reduced only like 5% with the 12 months therapy. We know very little about what happens beyond 12 months. There are some studies after 3 years. There is one cross-sectional study after 8 years. What they seem to suggest is that there is a plateau effect, which means that in the study that included a 3-year measurement, for example, there was not much of a change from 1 to 3 years. So this seems to indicate that the changes occur fairly rapidly. The small changes occur fairly rapidly, and then there's a plateau. And even in the cross-sectional study, looking at 8 years, they were still, I think it was 25% stronger than reference women, for example, on average, the transgender women. So that's the status right now. Everything we have so far suggests fairly small changes. And since the average differences between males and females are so big from the beginning, this means that only about 1/5 of the advantage is reduced, which creates this conflict between fairness and inclusion. So IOC and other sport bodies, they hoped, of course, that this therapy could work. We could have both inclusion and fairness at the same time. But currently the situation is that they don't go hand in hand. So sports need to prioritize. And this is, as you started this pod by saying, this is very, an emotive topic now and sensitive and discussed a lot because it's basically a colliding rights issue. Women have the right to have a protected category. Transgender people should be respected and they should also be allowed to play a sport. The question is, can it be done in the category they identify with, or can it not because of the biological sex differences and the implication for performance? But I think otherwise I think you covered most of it. These are, I mean, I'm a biologist and physiologist and sports scientist, so I'm mainly, focusing on those. So obviously there are, legal, ethical, social aspects of this issue as well, which makes it even more complicated.
Yeah, it's definitely a really contentious subject. I guess honestly, the intention of this podcast was I've just seen a lot of people talking about these things, and kind of, in my opinion, doing a pretty bad job on both sides, right? Because there's the research that obviously you and other scientists put out, and then there's this kind of game of telephone where by the time you see it, a post on Facebook, it's a pretty far cry from what was actually found in any of the papers that are being referenced. So the intention was more so just to get good quality information out there about the subject and say, okay, where does the research, put us right now? What are some potential directions of research moving forward? And what are the implications for trans women and just competitive sports in general, and in the landscape fairness, and kind of answer some of these questions without going too much into like ethics and
Yeah.
things like that. Just kind of strictly trying to stay into the more biophysical side of things. But are you working on any research at the moment with this?
Yeah, sure. So we're actually still running the study. We have some of the participants or patients. They have been several years now on hormone therapy. So we are planning to do a 5-year follow-up, and some of them are close to that mark now. We're actually planning on scanning them. Some of the first patients even a few months ago, but actually the sort of pandemic have created some problems to bring in people to the lab. But so that's what we're doing. We're planning a 5-year follow-up. We're also doing right now analysis on muscle biopsies that were collected. So we will in the future publish on what happens with fiber size, myonuclear density, capillary density, satellite cells. So basically to try to get some more mechanistic information of what actually goes on in the muscles, and potential explanations for their findings. And this is interesting not only we've focused everything here on transgender women, but obviously in transgender men as well, who increase a lot in muscle mass and strength. What are the mechanisms at the sort of muscular and molecular level, explaining those marked effects from testosterone, for example.
Yeah, that's really interesting. I would definitely look forward to reading that once it comes out. So we're kind of getting past the hour mark, and I definitely want to be respectful of your time. So where can people find you?
People can find me on Twitter and Instagram, where my name is TL Exercise on both those platforms. And through my institution, Karolinska Institute, that you can also find my email on the website.
Awesome. So all that stuff's going to be linked up in the show notes, guys. Thank you so much for jumping on, Tommy. It was really awesome, super interesting conversation, and I loved your paper. I spent the last couple of days just kind of going through it and reading some of the citations. It was really interesting. I was actually shocked by quite a few of the findings that you had pointed out in there. So
yeah,
thanks so much for doing the work. Thanks for jumping on here and kind of sharing this great information with everyone.
Yeah, thank you for having me.